Thank you, Mr. Chair. I have amendments.
Would you like to report the amendment?
Yes, Mr. Chair, Delegate Herring. HB 627, correct?
Yes, HB 627. I apologize.
On line 19, strike the current definition of healthcare professional, replace with any person licensed, registered, or certified by the Board of Medicine, Board of Nursing, Board of Optometry, Board of Psychology, or Board of Social Work. Next two amendments correct the correct numbering for the Fourth Amendment, which is making the provisions of the bill applicable to healthcare professionals with a salary of less than $500,000 per year. And then the section is also applicable to low-wage employees under current law.
Right. Thank you. Any questions or comments from the committee? All right. Delegate Herring.
The amendments are adopted.
Let's, sorry, and move the amendments. Second. All those in favor of the amendment, say aye. Aye. All those opposed? Amendments are before us. Delegate Herring.
Thank you so much, Mr. Chair. This bill will prohibit employers from creating new non-competes for healthcare professionals. And the threshold now with the amendment is there with a salary. It wouldn't apply for those who are making $500,000. Or I mean, it would. It can be those making more than $500,000 could be subject to a non-compete. Those making less would not in salary. It builds on the bill that we passed in 2020 that prohibited non-competes for low-wage workers. The bill is limited in scope to those that are licensed as described in the amendment. The problem, Mr. Chair and members, is that when non-competes are enforced against healthcare workers, it affects an entire community. If a physician leaves a large hospital system or indeed decides that they would like to provide services in another part of the state that would cover, the non-compete would cover, patients are prevented from receiving care, and nor could they even open up their own clinic just down the street. Healthcare professionals make up 45% of all non-compete agreements, and according to the American Medical Association, between 37 and 45% of physicians in the U.S. are subject to non-competes. Those who want to leave their current positions often end up leaving Virginia altogether. By forcing nurses and doctors and other healthcare professionals to stay in their pre-existing hospital systems, we're preventing growth that could lower costs and create better care. So the solution, Mr. Chair, is prohibiting non-competes for those professionals that fall within the parameters that are in this bill. We will have the option to move locally around the Commonwealth when looking for work. It will allow Virginia to retain its medical workforce while improving research and innovation. Research by the Federal Trade Commission has shown that this solution has the potential to lower health care costs by up to $194 billion nationwide over the next 10 years. Healthcare access would also be improved as states with this law already in place experience a more stable healthcare market with more practices and practice locations and fewer practice closures. The solution has been tested in other states such as Arkansas, Massachusetts, Minnesota, and Delaware, where the banning of healthcare worker non-competes experienced no expected significant fiscal impact on the state's economies. I hope it is the will of the committee to report the bill.
Thank you, Delegate Herring. Any questions or comments from members of the committee? Delegate Ballard.
Thank you, Mr. Chairman. Leader Herring,
Yeah.
I just want to make sure I understand the amendment because I'm kind of back and forth on this one, quite frankly.
Understand.
So before you had that category that included just about everyone, and then with the amendment, you narrowed it down to folks that are subject to like a board or a licensure, and then added the $500,000, I guess, I don't know if it's a cap or a floor, however you want to describe it. So you're not capturing your assistants, most nurses, I would say, unless it's like a nurse anesthetist or someone that makes a lot of money, and you're not capturing your physicians for the most part.
That's right. That's the intent. Absolutely. Yes. And I had a nice conversation with the chair about his concerns, and that's why we came up with this amendment.
Thank you.
Any other questions or comments from the committee? All right. Anyone here to speak in favor of the bill? Come on up.
Hi there. I'm Ashley Apple. I'm a professor, nurse practitioner, and vice president of the Virginia Nurses Association. Restrictive covenants do not protect patients. They restrict access to care. In rural areas, non-compete clauses force clinicians to choose between leaving their communities or leaving the profession. In some cases, just one job loss can eliminate healthcare across an entire region, and that deepens health inequities. Importantly, non-competes also disempower the healthcare workforce. They deter clinicians from pushing back against unsafe working conditions and expressing concerns about patient safety. It's a lot harder to speak up when doing so might force you and your family to have to leave the community that you love. So this isn't just a workforce policy, it's an access to care and a patient safety policy. The Virginia Nurses Association supports this bill, and we respectfully ask you to do the same.
Thank you.
Thank you.
Mr. Chairman, members of the subcommittee, Sarah Thomas with Vector on behalf of Virginia Council of Nurse Practitioners. We support this very important bill. Thank you.
Thank you.
Mr. Chairman, members of the committee, Jonathan Williams on behalf of the Virginia Academy of Physician Assistants, and we support the bill.
Thank you.
Mr. Chairman, members of the committee, Brittany Whitley with the American College for Nurse Midwives, and we support the bill.
Thank you.
Mr. Chair, members of the committee, Trevor Moncare with the Virginia Orthopedic Society, and we all support the bill. Thank you.
Thank you.
Mr. Chairman, Clark Barron of the Medical Society of Virginia. While we would have loved to have seen it open-ended, we appreciate the delegate for bringing this forward and look forward to working on it more. Please support this bill.
Thank you.
Amy Parent-Seibert on behalf of the Virginia College of Emergency Physicians. We too would have preferred the original version of the bill, but we support the concept and look forward to keeping working on the bill. Thank you.
Thank you.
Mr. Chairman, Bo Keeney representing the Virginia Optometric Association and the Virginia Academy of Clinical Psychologists. We both support the bill as well.
Thank you. Anyone here to speak in opposition to the bill?
Mr. Chair, members of the subcommittee, Brent Rawlings, Virginia Hospital and Healthcare Association. We appreciate the patron introducing that amendment. That is certainly moving in the direction that we are more comfortable with. Just to kind of explain our position a little better, we do not use non-competes blanket across the board with all of our healthcare providers. They're used in select instances with highly specialized professionals, and oftentimes they are paid at that much higher salary. And they don't come, it's not just a non-compete for the sake of a non-compete. It's always in exchange for some consideration. Oftentimes these employment agreements involved recruitment and payment incentives, payment of educational loans, practice development, financial support. So these are agreements that are not hidden. They're very explicit. They're mutually agreed to. They're carefully negotiated and compromised between the providers and the health systems, all with the goal of getting those folks to provide access to care to those needed services in our communities. With respect to the amendment, again, we really do appreciate that. The one thing we do want to consider is maybe taking a look at a little different number. We were looking at other states nearby. DC, for example, has a similar exception.
I appreciate it. We can talk offline.
Thank you, sir.
But we have to get through a lot in a short amount of time.
Mr. Chair, members of the subcommittee, Nicole Brenner with Seven Hills on behalf of the Virginia Chamber of Commerce, I will truncate my remarks. The Virginia courts have repeatedly recognized and enforced valid covenants not to compete. The courts have determined a reasonableness clause to ensure that there is no greater than necessary to protect the legitimate business interests, that there's not an unduly harsh or oppressive restraint on the employee's efforts to earn a living, and it must be consistent with sound public policy. We feel that employees are already protected from being unfairly disadvantaged. Economic development and a pro-business climate across the Commonwealth relies on stable, affordable, accessible health care for its employees, and we would ask you to oppose. Appreciate the conversations with the patrons so far. Hope we can continue them.
Thank you.
Mr. Chairman, members of the subcommittee, Jen Siciliano, UVA Health. I don't want to be repetitive. Brent made a lot of the same remarks that I was going to make, and I would say that we look forward to working with the patron because we do have some concerns about this bill and the fiscal impact that it might have.
Thank you.
Mr. Chairman, members of the subcommittee, Kara Gunther with VCU Health System. We have similar concerns to UVA's, especially as it relates to some of our very super specialized physicians that we often recruit from out of state with massive research teams that come to the state with them. But we too look forward to continuing to work with the patron. Thank you.
Thank you very much. Any additional questions? Or we have someone online?
Are they still on?
We have one individual online.
Good afternoon, Mr. Chairman and members of the subcommittee. My name is Erin Brickley, and I'm a practicing pediatrician in Southwest Virginia. I live in Abingdon and practice in Smith County. I'm speaking today on behalf of the Virginia chapter of the American Academy of Pediatrics in support of the bill. As a physician in a rural area, I have seen how these non-compete clauses can hurt our communities, which are always in desperate need of recruiting more providers. To put it simply, non-compete clauses force many providers to leave our communities. Providers are forced to choose between what might be a harmful working environment or uprooting their families and moving. This in turn can impact our patients and interrupt their continuity of care. A physician who has chosen a rural community like mine to make a home, raise a family, and provide health care deserves the flexibility to change employers when necessary, and this should apply to all healthcare providers regardless of salary. Furthermore, patients in these communities should be able to access the providers of their choosing and not lose qualified healthcare providers to unfair business practices. For all these reasons, we ask that you support House Bill 627. Thank you.
Thank you. Any more questions or comments from the committee? Delegate Helmer.
Mr. Chair, I would just ask the delegate, I'm trying to really get Chris. So prior to the amendment, who was included in not being able to have those NDAs, and now as we've adopted the amendment, like how is that?
Right. So, for example, an extremely well-educated doctor who has, there's an investment, for example, from the hospital. This doctor, for example, has extensive training and a specialty, is making more than $500,000 a year. And salary would still be subject to NDA. To the non-compete.
Any further questions, Delegate Helmer?
Mr. Chair, I'd like to speak to the amendment for a second.
Sure.
So, Mr. Chair, I voted for the amendment because as it came up here to chat about it, but I expected that in doing so, we would have some of the folks who were opposed be supportive of this, because I think it's a very important concept. These are incredibly important opportunities for the movement of labor to support healthcare, and most of the institutions we're talking about are nonprofit institutions focused on health. And so I don't know that's really the right space for us to have non-competes, even in the R&D space and things like that, which are dedicated to health. I wonder if having made that, having voted on the prevailing side, if the patron would regard it as friendly, given the testimony we just heard, to reconsider that amendment and go back to the original posture of the bill.
I think that we're going to, sorry.
Yes, I'll answer. I like the original posture too, but I'm just concerned because I had talked with the chair who had some concerns. So I love that. And also because, Mr. Chair, if I can take this moment, it was pronounced that non-competes have been upheld, and that's not accurate exactly, because this is why this bill was brought. A nurse was providing care in one hospital system and decided to continue to provide care in a community that had basically a desert in providing care. Mm-hmm. And she had to defend her actions in court. Hospital system tried to enforce the non-compete, and the court found that this nurse was able to do what she was doing. So that's part of the reason that I'm here. So. But I would certainly love it. Of course.
Delegate Runyon.
Thank you, Mr. Chair. Question of the patron. When we talk about the $500,000 threshold, does that include, for instance, first-year moving expenses or other inducements, scholarship payments or that type of thing?
No, it is just straight salary or wages, right.
Yeah, was there, Mr. Chair, follow-up question. Mm-hmm. Was there a discussion in the group when you were talking about that and coming up? Because that is a real expense to the healthcare provider. And was there consideration, or I would like to better understand, Mr. Chair, why that would be excluded? Thank you, Mr. Chair.
I think because then we are now we're moving more people into the arena where they would be subject to a non-compete. That's why I wanted to just base it solely on salary, because then you will be moving a lot of nurse practitioners and others into that
Mr. Chair.
Follow-up?
Follow-up, yes. I perhaps wasn't clear on that. It would still not exclude the 500. It would be would be dollars that made up that 500,000. So let's say that you had a $100,000 moving expense your first year and your salary was 405, then you would all of a sudden go above that $500,000 threshold. The next year, if your salary was still 405, you would not go above that threshold.
Understand, but Mr. Chair, I'm trying to follow procedure here. I will respond. My concern is just like the example I gave. Once that nurse, I'm just going to use a nurse for example, gets into the hospital system for that year, then she is restricted from providing care where care is needed. That's why. Yes. Thank you.
Delegate Ballard.
Thank you, Mr. Chair. Speaking to the bill as amended briefly, so I'm kind of on the opposite end of my friend Delegate Helmer on this. I like it better that it's amended, and I appreciate you working with folks to do that. I do struggle with both sides of it because I see the hospital's perspective in protecting their investment for some of these highly specialized, highly educated, trained physicians or other personnel that they want to retain and not open up a practice nearby to compete with them. But on the other hand, my big concern, as I think Delegate Runyon's concern will be, is rural health care and the ability to open up those family practices or other things that we really need to serve our community, especially like where I live. We have a hard time recruiting and retaining physicians. And so I'm a little bit on both sides of this. I do appreciate the amendment. I'm going to vote no now, and I'm going to think about it. Maybe that's an incentive for more lobbyists to visit me in my office versus giving me the Heisman stiff arm. But I do appreciate you working with them on that.
Delegate Helmer? So you're on the board still. Sorry, okay. So the perspective that I think that's coming from the other side of this is that, give an example of, say, a nationally recognized heart surgeon from Duke is recruited to go to Inova. And that nationally recognized individual was provided with a lab, they were provided with a $1 million salary, and also the ability to create new heart valves that are going to be, world-renowned and will help with life longevity and quality of life. And that person would then be, after all that investment went into that one individual, they would then be perfectly willing to go to Johns Hopkins at the drop of a hat right before the announcement of all the materials that had been done while at Inova. And so we're simply trying to, I think in some ways, balance this a little bit, at least in the short term, and we'll come back and maybe next year with some other options on how to address the overall cost and compete issue. But that was the motivation for at least this one amendment right now. Delegate Helmer?
I have a motion at the appropriate time, Mr. Chair.
Appropriate time.
Move to report as amended. Speaking to that motion, Mr. Chair?
Yes.
Thank you so much for bringing this forward. I think it's a very important bill. I'm going to take the opposite position, my friend, the delegate down there. I'm voting yes for now, but I would like to see us continue to evolve this to make sure that we're maximizing the opportunity for labor to flow where there's demand, and to make sure that we're providing the best resource wherever we can across the Commonwealth. So yes for now, but I'd love to continue to see us evolve the bill in a direction that ensures that everybody has access to high-quality, affordable health care. Okay.
Is there a second? Second. Moved and seconded. All right, let's go to the big board. All right. By a vote of 5-2, the bill is reported with amendments. Thank you, Delegate Herring.
Thank you. Thank you.